Hi everyone, welcome back to our channel where we bring you the latest in sports medicine, fitness, and updates on sports injuries in real time. Today we will be taking a closer look into Golden State Warriors All-Star guard's lower leg injury that happened during last night's game. Before we get started, make sure to click that subscribe button to stay up to date with all of our future videos and updates surrounding the sports medicine field. Now let's take a closer look into what actually happened last night. Golden State Warriors star, Steph Curry, was forced to leave the game last night against the Dallas Mavericks after suffering what seemed to be a lower leg injury. As seen, he seems to be in a lot of pain and is seen limping significantly off the court. The initial assessment appeared to be a left knee injury, which is a concern for any athlete. However, Curry is seen pointing more to his lower leg and looking deeper into the injury mechanism, and the way Curry's body responded to the contact provides some valuable information about the severity of the injury, which can potentially be good news. In this video, we can see the moment when a Mavericks player tried to drive in on Curry, causing contact with his knee on the outer lower leg of Curry's left leg. As a result, Curry's knee appears to move inward, creating a knee valgus position. This type of knee movement is known to increase the risk of major ligament damage, such as to the ACL. However, due to Curry's left leg coming up off the ground as soon as the contact happened due to the impact and force momentum, it reduces the potential for significant force and torque to be applied to the knee, lowering the risk of a severe knee injury. Had the foot stayed planted, there could have been a twist in the knee, which is what we typically see in ACL injuries where the foot is planted in the ground during a cut or pivot. Another potential concern could have been an injury to the area around the fibular head. A direct blow to the fibular head could potentially cause a fracture since there is a very small amount of support above it, but that is unlikely seeing as X-rays on Curry's leg came back negative, although it could have been overlooked. We are sure this isn't the case, however, because as seen in the video, the Mavericks player seemed to hit Curry more down in the lower leg area, so narrowing it down, it is more likely that the muscles or ligaments in the lateral or outer compartment of the leg are contused and bruised. These different muscles of the leg that could be injured are the Pyrenees longus, Pyrenees brevis muscles, or tibiofibular ligaments, which all help with the movement of our foot and lower leg. These types of injuries are seen in sports like MMA, where the fighters are calf kicked and it becomes harder for them to pick up their leg due to pain. As of this afternoon, the Warriors have released a statement saying that the injury was indeed an injury to those specific areas as we talked about earlier. He is said to have suffered from partial tears to his superior tibiofibular ligament and the interosseous membrane, as well as contusions in the lower portion of his leg. Ligaments are used to maintain the stability of joints between bones and are named after the bones they connect. So the tibiofibular ligaments, located in the joint between the head of the fibula and the tibia, or shin bone, were more than likely stretched when contact by the Mavericks player was made to the fibular head, causing a sprain in those small ligaments. The interosseous membrane is a connective tissue that runs down the entirety of the leg and connects the tibia to the fibula. So when the tibia is pushed forward due to a hit or trauma, not only can it affect the ligaments in joint, but can also stretch and sprain this connective tissue holding the two bones together. Contusions are basically just bruises to those muscle groups we mentioned before, which can be severely painful and will take time to heal. In conclusion, based on the injury mechanism and the information available, Curry was thankfully able to avoid serious and severe injury to his leg. It was determined by Warriors medical staff that Curry will more than likely be sidelined for a couple of weeks and then reassessed at a later date. With proper rehabilitation and rest, Curry could potentially return to the court in a matter of weeks, rather than months. The treatment for these types of injuries usually involves rest, ice, compression, and elevation or ice to reduce swelling and pain. Physical therapy may also be necessary to help regain strength and range of motion in the affected leg. Thanks for watching. Let us know your thoughts below. Click the videos above to learn more about the field of sports medicine and take a deeper look into injuries in the sports field. See you next time.